breakout session, Integration of Primary Care and Behavioral Health, Shifting to a Patient-Centered Model of Care. My name is Nancy Kelly. I'm the Vice President of Marketing Communications at Qualidigm, and I'm really pleased to introduce our speaker for this breakout session, Dr. Sabrina Trocchi. Dr. Sabrina Trocchi is a skilled and experienced expert on behavioral health, healthcare systems integration, and healthcare administration and management. As the Chief Operating Officer of Plainville, Connecticut-based Wheeler Clinic, she oversees a systemic approach to development and execution of organizational strategy, as well as a wide range of community-based and in-home services, including children's and adult outpatient, community justice, prevention and wellness, family and community services, congregate care, early childhood and psychiatric, medical, as well as grants, development, and quality operations. She's a very busy woman. She previously served as the Chief Strategy Officer at Wheeler, overseeing and implementing strategic partnerships, ventures, and alliances for the $75 million organization. She is a noted expert on person-centered care, evidence-based practices, medication-assisted treatment for addiction, and today's dynamic healthcare environment. Please join me in welcoming Dr. Trocchi.
Thank you, Nancy. Good afternoon. Sabrina Trocchi, very happy to be here with you for the next hour, talking about integration, primary care, and behavioral health, really looking at Wheeler and what we feel has been about a 20-year transformation of our system, but very happy to be where we are today and continuing to look at how we further integration. The objectives for today is really to share some of the strategies we've used to improve primary care and behavioral health integration, to really look at it from the perspective of patient and patient-centered care, and how patients really informed our model and how we're currently delivering it today. And then also looking at effective communication and collaboration. That's between and among our primary care providers, our behavioral health providers, but that is all circled around the patient and includes the patient as the driver around their care and the care that they are receiving. A little bit about Wheeler. We're a 51-year-old organization. When many individuals think of Wheeler, they think of behavioral health. For the last 45 years or so, or closer to 43 years, we were primarily a behavioral health organization that provided a number of other health and human service supports. About 7 years ago, we made the determination, based on input we received from our patients. We started to ask adult behavioral health patients across our various locations around their primary care access, and how they were accessing those services. I'll go a little bit into more detail on that through the presentation, but based on that, we decided it was time for us to transform our system of care and look at the integration of primary care services. Community need has always shaped Wheeler and Wheeler's services. So when we started in 1968, we started by, we were provided an endowment by Bertha Wheeler, who specifically was looking for Wheeler to develop a psychiatric hospital in Plainville, Connecticut. The community came together, and the community really felt that a psychiatric hospital was not needed. What was needed, it was more community-based in-home services so that children and families could be served within their homes, within their community. Based on the community input, we started the Wheeler Clinic. Wheeler started and today continues with strong partnerships and collaborations. We deliver many services, but we don't deliver all of the services. And today, as we factor in social determinants and really asking our patients, what are the barriers to care? There's some of those barriers that are outside of the Wheeler system. So partnerships and collaborations continue to be very key for us. We see ourselves, and many in the community see us as a highly respected, influential leader in primary care and behavioral health. A lot of that work started in 2015 when we became designated as a federally qualified health center, and I'll talk a little bit more about that. In 2016, we became Joint Commission accredited as a person-centered medical home too. We're a $76 million organization, about 1,000 employees. We have 34 locations across the state and over 100 different programs and services that are offered. Although we have locations in 34 locations across the state, we offer a number of services that are in-home. We touch almost every single community within the state. Annually, we serve about 24,000 individuals. Our mission is to provide equitable access to innovative care that improves health, recovery, and growth at all stages. Our vision is that all people, all individuals we serve, will have the opportunity to grow, change, and live a healthier, productive life. As part of our strategic planning process, the overarching strategy focus for us has been and continues to be for the last several years, really focused on health disparities and health integration. Our strategic goal is to reduce disparities in healthcare availability and access for vulnerable populations that provide collaborative integrated primary care and behavioral health care, resulting in improved overall health and wellness outcomes. Our strategic focus is developed in partnership with our staff. It has input from our board, our trustees, and so it comes from multiple levels. And the important piece for us is that there's buy-in for integrated care across all of those levels. Person-centered approach. The patients we serve are the drivers of care, and our job, oh, is that working? I'm not sure. Our job, I don't know if folks still can hear me. Our job is to continue to ensure that the services and supports that our patients need are built around the patient. So we offer primary care, dental, behavioral health, care management services, which I'll talk a little bit more about also, individual and family supports, prevention, health, promotion, and wellness, pharmacy and lab services available on site or through delivery from the pharmacies that we work with. Health information technology. I'll talk a little bit about our electronic medical record. It's an integrated system that incorporates all of primary care, dental, behavioral health, in addition to care management and population management technologies. Community health equity, looking at disparities and making sure that we're asking those questions around what barriers are our patients identifying around their ability to access the services that they need to access. So why focus on integrated care? I mentioned 7 years ago or so, we started to ask our patients around what they were seeing or how they were experiencing primary care. The questions we asked our patients were, do you have a primary care provider? When was the last time you saw that primary care provider? And when you need services, where do you go for services? Overwhelmingly, our adult behavioral health population was reported, about 60% reported, not having a primary care provider. If they reported a primary care provider, our follow-up question was, when was the last time you saw that primary care provider? And based on those responses, it wasn't regular. It was maybe within the last 3 years or 5 years. Our patients reported at least one chronic health condition in addition to the behavioral health conditions. At least one. Many of our adult patients reported multiple chronic health conditions. When it came to where do you access services, overwhelmingly, our adults reported they were going to the emergency rooms for medical care. There was no preventative care. It was, I'm not feeling well today, that's where I'm presenting for care. So we've took that information and determined that we needed to do something different. We needed to improve the health of our population, our adult behavioral health population at that time. We started to look at integration, and what did integration mean? Here's one definition that really jumped out at us. The care that results from a practice team of primary care and behavioral health clinicians working together with the patients and their families, using a systemic and cost-effective approach to provide patient-centered care for a defined population. This could address mental health, substance abuse, behavioral, primary care. It could include stressors, crises, stress-related physical symptoms. So we started to figure out how we would proceed in ensuring that we started to move towards integration. We started small. We started by looking at opportunities to screen and assess all individuals presenting for care. As we established as a health and wellness center, regardless if a patient is entering for a primary care condition or a behavioral health condition, we're screening and assessing all patients around behavioral health and physical health needs. We're placing lots of emphasis around preventative care, education for patients around why they should be screened for a number of conditions, why they should be vaccinated. And so we're looking for opportunities not only to engage in care, but to ensure that the patient understands the overall benefit of preventative care. We're starting to look at how we reduce fragmentation. So, and this is an area that we spent a lot of time on, ensuring you could have primary care and behavioral health in the same location, co-located, yet not delivering integrated care. There's a number of pieces that need to be workflows, either clinical workflows and just regular patient workflows, that really need to be reworked and transformed in order for those different players to come together as a team to really work with the patient around integrated care pieces. So our goal was really to establish ourselves as a health home for patients presenting to us, regardless if they were coming to us for primary care or for behavioral health conditions.
For my medical care here at Willow Clinic, I can do it all in one shot. I can come here if I'm sick. I can come here if I got a headache. I can come here if I got an ankle sprain.
Getting all my medical needs met here at Wheeler makes life a lot easier for me. I have all my doctor's appointments here. I have my one-on-one counseling here. I get my Vivitrol shot here.
If I had to go to individual physicians, I think I probably wouldn't make those appointments because it's too much for me. I think it would cause me a lot more anxiety if I had to go from one physician to the next.
I think in the future of healthcare, we're really trying to improve quality, reduce cost, and add value. And by providing integrated care, they're able to get everything that they need in one place.
So re-engineering integrated care is what we've focused in on over the last 5 to 7 years, where we really started to look at primary care as an access point for all health care, including behavioral health. As part of that, we continue to evolve our primary care services. So in the last 3-4 years, we've really started to use primary care as the primary vehicle for addressing the opioid issue we're seeing within our communities. And so when it comes to, for example, medication-assisted treatment, the expectation is the patient can enter our system from any point. Medication-assisted treatments will be offered in primary care, in psychiatry, in behavioral health, so that the patient does not need to see multiple specialists in order to get the care that they need, that the team works around the patient doesn't have to work around the team. For many patients, we know that primary care is actually where they're going to get most of their behavioral health services. And so in a system like Wheeler, where we have specialty behavioral health and primary care that can serve behavioral health needs, we know that when it comes to specialty behavioral health, I have a longer wait time for those services. And so when thinking about primary care and and how they could be the front line to addressing a number of the behavioral health conditions, that was an area of focus for us. I mentioned that in addition to the medical behavioral health, we now have incorporated within our EHR system the ability to capture the social determinants of health. So we're asking questions around transportation, housing, educational supports, food insecurities. We're asking a number of those questions because they are barriers to care. And we know we have patients who, because of those barriers, aren't adhering to their medications, aren't adhering to other preventative medical supports that we know will lead to a healthier life for them in the community. We focused in on our multidisciplinary teams. So within our health and wellness centers, we have teams that comprise of primary care, internist, pediatricians, we have a dentist on staff, we have nutritionists, then we have behavioral health, we have psychiatry, we have behavioral health clinicians, we have support staff, nurses, medical assistants, we have recovery specialists, we have community health workers. And so that's an exhaustive team, but it's the team with the expertise that's needed in order to support the complex patients that we see. Our goal is to improve communication, improve care coordination, to look at expanded health management supports so that patients are provided the skills and supports to be able to self-manage their conditions, regardless if it's behavioral health or primary care. And another goal for us is to support patient engagement. So the more we can have patients drive their care, the more engaged patients will be in self-management. Around the social determinants, we did ask a number of patients before opening up our health and wellness centers to understand what is currently not working within existing healthcare systems. So why aren't you connected to a primary care provider? We needed to understand more of those pieces. And some of the feedback we got from patients was not feeling connected to the primary care providers that may be within their community. And that included a number of things. It included potentially not having a provider that was of their gender, not having a provider that was of their race and ethnicity, not having a provider that was local to their neighborhood or their community, who could understand the nuances of that neighborhood. We also looked at, asked about other points. How could we further engage you into primary care? And some of the feedback we received was really, really interesting. Patients were saying, we want to feel respected. We want to feel welcomed. And that's really hard to hear. It's hard for someone to, think of us within our own health care. Would you go back to a primary care provider if you felt you weren't being respected, listened to, involved in the decision making for your own care? So we took all of that feedback and really focused in on how to develop health and wellness centers within our communities that really were informed by what patients were telling us was not working. So we moved forward and established our integrated primary health care centers. We call them the Health and Wellness Centers. We currently have 3, with number 4 being opened up very soon. We actually started to deliver some primary care now, but are waiting to for additional approvals to proceed with other services. So Hartford, Bristol, New Britain, Waterbury. Hartford is our flagship location. So in Hartford, that's the community that we started off in, and that's the community where we have a 50,000 5-floor building that provides fully integrated care. We offer adult and child primary care, pediatric services. We have 4 full dental operatories. We have a teaching kitchen, nutritionist on site. We've partnered with Holcomb Farms to bring fresh vegetables and fruits in the summer months to that location so that we can share them with patients. This will be our 2nd year doing that. One of the interesting pieces and why we really focused in on bringing a nutritionist is when we first brought the fruits and vegetables, a lot of it was being left behind. Patients would walk right by, look at it, and not pick it up. And what we quickly realized was that some of these fruits and vegetables were not familiar to the various individuals and cultures and ethnicities that we serve. And what we found was having the nutritionist look at, for example, how you could use a vegetable in using culturally responsive or culturally specific spices or other recipes or other ingredients. They were able to work with patients around, this is how we use this vegetable, and this is how you could use it in a Latino rice dish that was familiar to the patient. And so what we quickly found was, with that additional support, that the vegetables were going, and people were starting to feel excited about coming to Wheeler on Fridays in the summers because they knew they would leave with vegetables and fruits. So that's very exciting work. We've also expanded, based on patient input, we've expanded alternative services. So we offer chiropractic services. We offer acupuncture services within that location. And so we're continuously looking at opportunities to expand our services. We've added yoga, Zumba, and a few other exercise programs also. But that really, the intent of the health and wellness centers is to really enhance health equity, equal access to services for all individuals that come to us. And most of the individuals we serve within our targeted communities are low-income, vulnerable populations with very serious behavioral health conditions, including substance use disorders, and the significant majority have a chronic co-occurring medical condition. We received our designation as a health center originally in 2015 in Bristol and quickly expanded to Hartford, New Britain, and Waterbury will be up and running this summer. So the health and wellness centers are supported by a multidisciplinary team. Our primary care providers, I mentioned who, we have internists, pediatricians, the family practice APRNs, we have a dentist on staff, psychiatric providers, we have behavioral health clinicians. We recognize these as our specialty behavioral health clinicians. So these clinicians offer traditional outpatient, intensive outpatient, substance abuse, mental health, individual and group sessions. Then we have what we call our behavioral health consultants. We have a psychologist in Hartford and are currently in our other locations have licensed clinical social workers. These individuals we would see as more generalist, and I'll talk a little bit more about them as in a further slide. But these individuals work embedded within the primary care team. They are consultants to the primary care team. They go into the exam rooms with the primary care provider as needed, as requested, and I'll go into more detail about that. And then we have a comprehensive care management team, the RNs, the community health workers. Community health workers for us are individuals that must be, the number one criteria is they must be residents of the community that they're serving. So we don't have any educational requirements with that position. We will train them on specific health areas of focus, but they have to be, so for Hartford, they have to be a resident of Hartford to serve that community. Peer specialist, once again, peer specialists for us are individuals with lived experience in either mental health or addiction who serve as coaches, as mentors to the individuals we serve. So the behavioral health consultant on the primary care team, they're embedded within primary care. They share the same patient panel as the primary care providers. They share the same population health goals as the primary care providers. Excuse me. They're in the same physical space. They have the same clinical flow. They co-manage the same population. They coordinate care for the same population. There's a patient handoff, and I'll talk a bit more about how that happens. Their goal is to provide a brief assessment, a brief intervention right in the exam room. In some instances, they may ask the patient to come back, but most instances, they will pop in to see the patient when the patient's coming in to see their primary care provider. They're very flexible schedules, so they're not a traditional behavioral health clinician that is scheduled. Their schedule is open. They drop in, they consult, they see patients that are scheduled and being seen in primary care. Our behavioral health consultant model is based on the Cherokee Health Systems model. Cherokee is a provider, a large healthcare provider in Tennessee. They actually started off very much like Wheeler. They were a behavioral health organization for many, many years. And then about 15 to 20 years ago, so they've been doing primary care for longer than Wheeler, they decided, very much like we did, that they needed to do something to change the curve on health and unaddressed health conditions with adults with behavioral health conditions. So they've been working in their behavioral health consultant model for quite a while now. We've actually gone out to them to shadow them. They've come out to us to provide on-site training and consultation around their model and how we embed them within our primary care teams. They offer real-time behavioral health and psychiatric consultation right in primary care. Their role is a little different than a traditional specialty behavioral health clinician. So in many instances, we have to retrain them around what their role is in primary care. So it's seen more as a behavioral health or behavioral medical scope of practice. So they encourage patients around taking responsibility for healthy living. They look at how to support patients on managing psychosocial aspects of chronic and acute primary care disease. They really look to apply behavioral health principles to address lifestyles, behavior change, health risk issues. So when you look at a behavioral health consultant and what it looks like in practice, we could have a patient come in for a primary care visit regarding pain management. So the patient presents with severe back pain. The primary care provider does a brief behavioral health screening, identifies that the patient may be depressed. The primary care provider lets the patient know that she would like one of her colleagues, a behavioral health consultant, to come into the room. The behavioral health consultant comes into the room and does a very brief assessment just to see if there's any other risks that should be assessed for. And then what the behavioral health consultant does is ask the patient, what are your goals around your health? Not around your behavioral health, but what are your goals around your health? In this instance, the patient says, I want to manage my pain. I want to be more mobile. So the primary care provider and the behavioral health consultant together work on a plan that will include physical interventions, physical therapy, plus behavioral health interventions to help relieve some of the stressors this patient's feeling around his injury and how the injury is interfering with day-to-day activities. That intervention is provided in real time to that patient then and there. If the behavioral health consultant feels that they need a follow-up session with the patient, they can schedule a follow-up session that would happen once again right in primary care, or they can say to the patient, you're coming to see Dr. X next week. I'd like to pop in for like 5 minutes and just check up on you. And that's how most of the services are delivered within primary care and the behavioral health consultant. In instances where the behavioral health consultant feels that there are more significant behavioral health concerns, that's when they would reach out to our in-house specialty behavioral health clinicians. And that would look more like traditional behavioral health, where there would be a warm handoff, but they would be assigned a behavioral health clinician. They would receive a full behavioral health psychosocial assessment. They would come up with a full behavioral health treatment plan on how to address the behavioral health conditions that have been identified. So that's how they would be able to manage all of those pieces through the specialty behavioral health if that's what's needed. Staff communication and coordination is absolutely key. Daily huddles. So the behavioral health consultant's role is every morning before those 10 to 15 minute daily huddles, they look at the primary care provider's schedule. They look to see what patients are coming in. And they'll do a quick scan to look at the problem condition that's identified. They'll do a little bit of research to see has a screen been done for depression or other behavioral health? Is there a role for me? In some instances, they're identifying patients right from the schedules in the morning. They'll go to the primary care provider and say, your patient that's coming in at 2 o'clock, although they don't have a present behavioral health condition, reading her record, I see that she may have had a substance use issue 20 years ago. I'm also seeing that she's coming in for pain. I'm also seeing that she's talking about potential depression pieces. So the behavioral health consultant takes it upon him or herself to proactively identify patients in the primary care schedule that may benefit from a behavioral health consultation. And vice versa. A patient might not screen positive for depression. A patient may not have any other indication, yet during that interaction with the primary care provider may say something or the provider might just have a feeling this patient may benefit from a brief consultation with a behavioral health consultant. So that flow can happen in any which way. In addition to the daily huddles, which are quick, they're quick. They include the primary care, the medical, the behavioral health staff, the community health workers, but they're quick. They're 5 to 10 minutes in the morning. We have weekly multidisciplinary care teams. This is where we spend a little bit more time to identify patients that are not following up in care, and that we know there are chronic health issues, we know there are behavioral health issues that are not being addressed. And as a team, we begin to identify, do we send a community health worker to the home to see what's going on in the home? Do we follow up with the patient? Or if the patient, we have patients who will come in for primary care or come in for medication-assisted treatments for opioid, but not come in for the other parts of the services. So we look for those opportunities to say, we know Joe will be here Monday to see primary care for Suboxone treatment. Let's have behavioral health or the dental assistant or whichever other gap in care we've identified be present for that meeting to connect with that patient before or after, or sometimes even during the primary care visit. Informal face-to-face. So the way we're set up is we have these open pods in the middle and exam rooms all around us. No one has an office. So primary care, behavioral health, you're all in these pods. You have no choice but to bump into all the other providers. And what we find is that it just offers a natural opportunity for individuals to say, hey, I just saw patient X, and I think you saw him last time. Let's talk about some strategies to get this patient re-engaged. So there's a lot of that informal communication happening. Consultations, either with the patient in the room. When the patient's not in the room, there's always the opportunity for consultation. And the consultation happens both ways. So it could be behavioral health saying, hey, what does that diabetes number mean? And what should I be doing around behavioral health treatment to help the patient to be in compliance with their medications? And vice versa. What does it mean when a patient is presenting with these behaviors, and what should I be addressing? Integrated charts, and around the consultation also happens between medical and psychiatry. So we have instances where, for example, a patient presents to primary care, and primary care begins the psychiatric medication for the patient. They're seen in primary care today. If patient needs to be scheduled and referred to a psychiatrist, it could be a week, it could be 2 weeks before they see the psychiatrist. So we look for the opportunities for primary care to consult with the psychiatrist and to say, this is the patient's presentation. This is what I'm thinking around beginning for medications. What do you think? And so we have that real-time consultation so that a patient can begin to receive the medications they need today versus having to wait a week or 2 weeks to see a specialty provider. For a patient like that, if the patient comes back to primary care and patient isn't feeling well and patient's not stabilizing, not doing well, we will do a quick handoff to psychiatric. But when we look at our psychiatric capacity, we have more capacity in primary care, and we can provide more real-time care in primary care. So we're looking for those opportunities. And then integrated charts, which I can go into in the next slide. So we have a single integrated medical record. Primary care, dental, behavioral health, our care management documents in there, our social determinants of health data is in there. It's all in there. And so all of our staff have the opportunity to go into a record, and if there's a concern or a condition that needs to be addressed, it pops up as an alert. So you know that if a patient who just presented for behavioral health, if they're missing a follow-up screening test for something that they were identified for, the behavioral health clinician will see a pop-up when they try to document their service for that patient that says, hey, reminder, this patient has a gap in care. Before patient leaves, remind patient and help patient connect to primary care to follow up on that screening test. Which is, we had to do quite a bit of rework within our EHR system to get it there, but it's just a wonderful tool for our staff to have. In addition, our population health management, we're able to look at our population and by different conditions. So I'm able to look up all of my patients that, for example, have diabetes and a co-occurring behavioral health condition. I can look to see how they're being, what services they're accessing, who's coming in, who's not coming in, who has gaps in care. And then our system allows us to identify those patients that could benefit from a care management contact. And so our system then refers them to our care management team to say, patient X has these conditions, patient X has not come into care in a period of time. It will even tell us patient X presented to the emergency room this weekend. So we need to connect with this patient to see why or how we can re-engage patient into care. We've done a lot of work around workforce staff development. Our whole focus, educating and re-educating staff around whole person care, understanding behavioral health concerns and including substance use and health conditions, really working with behavioral health clinicians to have them understand what their role is in overall health. And you know, it isn't conveying to behavioral health clinicians that they now have expanded their scope and are to perform or practice medicine, but it's saying to clinicians that they have a role in the patient's health. And if that means looking at their diabetes, for example, and factoring that into the behavioral health plan and how a behavioral health plan can help the patient address their chronic medical conditions, then that's how we would address that within behavioral health. We're looking at launching a psychology doctoral internship this fall. We're hoping to have 2, and this is all around behavioral health consultant and integrated care, and really beginning to introduce and develop the next wave of psychologists that are really focusing in on integrated care and being able to practice within an integrated care setting.
Our staff know that wellness means considering all its dimensions in harmony. It's difficult to be well if important elements of your life, such as housing or transportation, are out of reach. Physical wellness is dramatically affected by underlying behavioral health issues, such as trauma or anxiety.
What's exciting about being at Wheeler Clinic is the opportunity to provide whole person care that thinks about physical well-being, mental health well-being, but we also have expertise in care coordination, in understanding that individuals, to be well and healthy, have to have jobs, have to have social supports, have to have housing. And so I think an exciting part about being at Wheeler Clinic is that we provide all of those services across our agency.
A new employee at Wheeler working in an integrated care setting can make a tremendous difference in an individual's life. By looking at the whole person, looking at their physical health care needs, their behavioral health care needs, and their social service needs, you can put together a really unique package for that individual that they're not going to get anyplace else. And you can be the one that can drive that service plan and help that individual toward a different level of recovery than they have ever experienced within their life.
So what we're seeing, some of the benefits of integrated care, patients providers, both primary care and behavioral health, looking at their shared decision-making responsibilities and really feeling empowered in being able to drive their own care, and for providers to really feel empowered and having all of the tools available within that one location. Reduce frustration for patients. I can't tell you how often this one comes up, where patients say to us, I don't know how I could see 2 or 3 different specialists in different appointments and not at the same location, and how logistically I would get there, and then not even logistically how to get there, but then they don't talk to each other the same way that you guys talk to each other around my care. Increased coordination and communication across the board. We're seeing that. Patients are empowered to treat their own illnesses, manage their recovery. Greater satisfaction with care. We're seeing the highest patient satisfaction scores than we have seen in a long time, and that's really, we believe it's because of our integrated care model and our ability to really offer patients what they need when they need it. Reductions in disparities and timely access to care. Our primary care real-time access has really provided us the opportunity to offer real-time care. Our Suboxone program, we're able to see patients same day. And that's because we're using primary care as the primary area for patients to come in and to be able to initiate those services. A service like medication-assisted treatment, most primary care providers are not interested in offering that service. The difference within Wheeler is you're offering it in a location where you know you have psychiatry, you know you have behavioral health clinicians who are there to further support you and further support the patient. Reaching patients who may not access specialty behavioral health care. So we have patients, and we have a number of referral sources in the community. When referred to behavioral health, patients sometimes are reluctant to present for behavioral health. Yet, you say go to a primary care provider, patients have less reluctance to do so. So our ability to see the patient at that point, at the primary care point, and then begin to identify, gain the patient's trust, and then be able to engage them in the other services they need is absolutely key. So our system transformation is 20 years in the making. We started 20 years ago by co-locating, where we had behavioral health clinicians going into pediatric offices or primary care. Where we are today with a fully integrated system, a fully integrated model, took a while for us to get there. And it was more than just the clinical workflows, it was more than just the EHR, the electronic medical record pieces. A complete system and cultural change that we had to. Folks can still hear me though, right? Okay. So as part of that, it was really educating all of our providers around whole health, what whole health means, and really the focus on promoting better quality care and outcomes for the patients we serve. We speak about behavioral health being primary care. They go hand in hand. Communicating that good health, wellness, and recovery go together, and we spend a lot of time really working with patients around this piece. When a patient is presenting in crisis, sometimes they don't want to hear about preventative care and why they should be screened, but it's really looking for the opportunity to continue to have that conversation with patients, and looking for the opportunities to engage them. It might not be the first time the patient comes in, patient may have to come in for quite a while before we can get them to that point, but it's always having that being the foundation of all of the conversations we have with patients. And we try to focus on healthy bodies and healthy minds.
We all have our own challenges and needs. Wheeler's Health Centers provide complete health care. It's primary and dental care, even OBGYN and wellness, behavioral health and addiction services right in your community. Care centered on your strengths that helps you take care of yourself. Health care for everyone, so you can grow, change, and live a healthier, productive life. Wheeler, innovative care, positive change.
Okay. I'd like to start